Okay, so today we're going to talk about the arteries of the lower extremity. So let's get started. And if you recall from the last video, we talked about how we had the abdominal aorta. And what happens with the abdominal aorta, what we said, is that it's going to bifurcate or split into two, and it's going to be called the common iliac artery. Okay, so it's the common iliac artery. Now, this is the left common iliac artery. This is the right. And so remember, it goes by the patient's side. So what we're going to do is I'm just going to ignore this one over here. Everything I write on this side also applies to the other side. Okay, so we have the common iliac artery. And then what's going to happen is, coming off the common iliac artery, we are going to get the internal iliac artery. Okay, so this is my internal iliac artery, and it's going to send blood to the pelvis, to the pelvic region, the muscles and organs in there, okay? And then we still have the common iliac artery, but then if we have the internal iliac artery now, or let me put it this way, if we have an internal iliac artery, we must have an external iliac artery. All right, so we have an external iliac artery. And then from my external iliac artery, it's going to come down, and it's still the same artery, but now it just has a different name. It's like driving on a street, and then the street changes names. That's what's going to happen here. So when it gets into the thigh, if you recall, when we studied the thigh before, we called the bone in the thigh the femur. Well, this is going to be called the femoral artery. So this is our femoral artery here. Then this comes down to the knee, and I'm just drawing a circle to represent the kneecap so you'll know where you are. And we have the knee. Okay? So now, after when the same artery gets to the knee, it's called the popliteal artery. And then what's going to happen with the popliteal artery, it's going to trifurcate. In other words, it's going to split into three separate parts. So the first part it's going to split into is called the anterior thigh. I'm sorry, the anterior tibial artery, not the anterior thigh, the anterior tibial artery, okay? And this is going to be where your shin is. Okay, remember when we studied the tibia? So imagine this part's actually coming out towards you. And then what's going to happen is part of it's going to go backwards. All right, and I'm going to call this the, let me scoot this up a little, posterior tibial artery. All right, so this is my posterior tibial artery. And then, oh, by the way, so this is back where your calf muscle is. On the back of your leg, you have the calf muscle. Okay? And then we are going to have the fibular artery. If you remember studying the fibula bone, which made up your lateral malleolus, this is the fibular artery. So the fibular artery does the lateral leg. And remember, the leg goes from the knee down to the ankle. And so this is the fibular artery right here that's going to do that. And that is the arteries of the lower extremity. So now next we'll go on to the foot.